Well, hey everyone, it is great to, I guess, kind of see you. Uh, we just want to talk a bit about the COVID-19 surge and what we're doing as an organization. So we're going to be presenting a lot of information. You're going to get a copy of this. We're going to ask that you talk with your staff. And as we go along, please jot down your questions or throw them in the chat box so that we can make sure we respond to all of those questions in the end. So our goal today, we need to give you some critical updates, as I just said. We need our leaders to help reinforce the safety measures across the organization. It's really important we have consistency. So make sure you're sharing this information on a really, it has to be multiple times, right, for people to be able to hear it. So, in your direct supervision, in your meetings, conversations, please continue to reinforce these things. And then as you hear things from your team or you experience issues that we haven't thought of, please make sure you push those up toward us so we can make decisions regarding those issues. All right, so just a couple of updates. As you know, Cuyahoga County has continued to see staggering rise in COVID cases. The current models that we're hearing about in our calls is that we're going to rise to about 1,000 cases per day just in our county in the next week and 2,000 in the next 2 weeks. The really high incidence of cases. So in the last couple weeks, we've gone from 100 cases per 100K to over 650 cases per 100,000 people, which is way above what you would consider to be a high level of spread. Our demand for testing is really through the roof, over 400 calls a day, lots of visits to our webpage as well. If you happen to be down at the main building, you'll see a pretty long line of cars today. And we expect Saturday to be another big day of people coming in looking for testing. We're continuing to closely monitor the situation with our hospital and health department and health center partners. We're actively planning additional measures we can take to keep our team safe and our clients safe. We receive weekly updates, so we're lucky in that we get pretty up-to-date information. The chief medical officer from the Department of Health is on every single one of our calls, so every week, so we get a pretty in-depth view into what's going on and what we need to do. So based on some issues recently, we've decided that the early learning centers will close the week following Thanksgiving. So that's November 30th to December 4th. And then they'll also close again between January 4th and January 8th. The reason for this is that we really believe that it's possible people are not going to be as compliant with reducing their family activities over Thanksgiving and over New Year's, and that those really create significant spread in the community. So to help to decrease that, but also remain open over a longer term to serve our families, we're going to take this interim step. If you're not aware, we had to close Gordon Square because of the Early Learning Center at Gordon Square because of some exposure. We've also had to close a couple of individual classrooms across the early learning group. So we also would like to ask that all staff who are not essential to on-site work to continue working from home. If you or your teams can work from home, you should work from home. And if you have any questions about that, like I'm not sure if I should or not, then please make sure you're talking to your manager or chief to get that information. But as much as possible, please work from home. It helps reduce spread. The health department's asking us to do that. They're asking everyone to do that. Because of the COVID surge, we have instituted the incident command model. The incident command model is a model developed by FEMA. It was initially actually developed because of the 9/11 crisis as well as the Katrina. And it's a way to really organize your resources so that you have clear communication and you can make really quick decisions. So this is a little different than how we typically do things here. This doesn't change overall organizational structure, but as it relates to our COVID response, we're changing to this incident command model. So in this model, I'm the incident commander. Within the model, you have a big focus on communications and public information. Alexa will be playing that role. Operations, which is really about how are we operationalizing the decisions we make with COVID to keep all of our services operating. Carol is going to be stepping into that role. Logistics is making sure that the organization has what it needs to get the job done. And Elizabeth is the obvious person who'll be doing that. Planning is really an area where we're looking at what is the data we need to measure how we're doing against our goals, and that we have data so we can adjust our plan if needed. Finance is the next role. Jim obviously is in that role, and then HR. Carrie will be present because, obviously the overwhelming majority of our work is all about people, and so we want to make sure that we have her present to be able to help us remain focused on that. So there's 6 goals here that this team is focused on. Our financial stability, as you can imagine, if we have a lot of people get sick who produce revenue, that's going to have an impact on our financial stability. So we want to be planful around that. We want to maintain our critical services because it's not like we can just stop serving who we serve. Mental illness and mental health issues are getting worse, not better, under the COVID crisis. So we want to remain available to them. Early learning, our families still need to get to work, and in healthcare and our employment services need to continue to go because they're so critical to the people we serve. So that's another goal. Employee health and safety. If our employees are not healthy and safe, then we're not going to be able to get the job done. So we want to make sure that we're doing everything we can to create a safe environment. We're going to be expanding COVID testing. So right now, I think we're up to 5 days a week. We've moved most of those days down to as you probably have seen from the emails, we've moved it down to our Midtown location, or East, or whichever name you want to use, NLP. And we're looking to how we can expand it because the demand for testing is up, and we know that if we can get more testing done, we can help reduce spread. And during that, we're also preparing for how are we going to participate in vaccine distribution. It really does seem like the vaccine is going to be available in December and start to be distributed. We have healthcare workers here who are first responders, and so they're going to be able to get that vaccine and then move quickly into how to get the community vaccinated. And then our business continuity is the last area of focus with this group, is making sure those key areas that have to operate, we have a backup and a backup to the backup. A really basic example is payroll. If we only have 2 people who know how to do payroll and they both get sick, we're going to have a problem, right? So we want to make sure that we have backups to that so that we can continue to have our basic business operating. Is this you, Carrie?
I think it is.
All right, go for it.
Or
Alexa?
I feel like I skipped a slide, or hold on. Give me 1 second. But yes, Carrie, why don't you do this one real quick?
I'll talk while, we figure it out. Okay. So as Eric said, it's really important that, especially during this time when we're seeing such a high level of community spread, that we keep our work sites safe for our essential staff. This will allow us to have that business continuity that we need, and the important services to our clients continue. So it's really important that if you can work from home, if your teams should be working from home, that they do work from home and not on site. Make sure that when you are on site that you're wearing a mask at all times. The only time a person should be taking their mask off is when they're behind a closed door. Make sure you're maintaining that 6 feet of distance. And I think there's been some confusion around, well, if I've got a mask on, isn't it, isn't that kind of a little bit looser? No, it's not. So if even if you're wearing a mask or a face covering, it's really important that we maintain at least 6 feet of distance, and that we're doing proper hand hygiene frequently. So it's whether you're washing your hands or using hand sanitizer. Another thing that I really want to stress is the importance of staying at home if you're not feeling well. We've had some reports recently of staff who were just feeling a bit fatigued, staff who were feeling like maybe with the change of weather, they were just maybe having a little upper respiratory issue. And, some of those cases have turned out to be COVID. Some of them haven't, but when we're in this very high risk situation like we are today, it's best if you just stay home and make sure that, we're not spreading that to others unintentionally.
Can I jump in with a little story?
Yeah.
Because just to help illustrate this, because all of you can use this not only in the work site, but as you make your decisions about how you're going to manage your holidays. So one of the cases that I heard about where there was some spread that was surprising to me, but it shouldn't be, because it really illustrates the airborne nature of this. So there was a group of, I think, 6 guys who were at work, and they were doing a presentation, and they were all separate. They were all spread out in this room. They were all wearing masks, except as they took turns presenting, they'd go up to the front of the room, and so they could speak more easily. They took off their mask, did their presentation. Everyone was still 6 feet away. Did their presentation, put their mask back on, went and sat down. One person was asymptomatic COVID. All 6 of them got sick, because as they went up to the front of the room, COVID is lingering in the air, and they all breathed it in when they took off their mask, and that's how they got sick. So that's how contagious this thing is from an airborne perspective. The 6 feet in masks all of the time.
Yeah, thank you, Eric. Yeah, and I think we've seen this even with some families who have gotten together thinking that it was very safe. There's a family back in, I think, June in Texas, where 18 of the family members came down with COVID, even though they did what they thought was, distancing and sort of pacing out when people would arrive to this party. So an important reminder as we approach Thanksgiving and some other holidays about just how dangerous it can be to share that unfiltered air. So important to be careful. And speaking of Thanksgiving, it's really critical that we all practice good safety around COVID during the Thanksgiving holiday, and even going into the end of year, Christmas, Hanukkah, New Year's, other holidays, that we're not gathering with members outside of our immediate households, especially if we're inside, and especially sharing food. The CDC has some really good advice and guidelines that I posted earlier today to my centers under the HR page that you can check out, and certainly direct your team members there as well. It would be incredibly helpful if you would help to reinforce these safe habits for Thanksgiving that are coming not only from the CDC, but our local health department. There's an article here from cleveland.com that just point out how very critical it is to think creatively about how we celebrate the holidays this year, whether it's doing something virtual, maybe doing like a drive-by, wave hello from the car, maybe stay out on the porch, very socially distanced, or in the backyard, to make sure that we're keeping everybody safe. And of course, this is something that we want to get out there. We want to get this information out there. People are going to make their own choices. But the more we can put factual information in front of people to help them make the best decision for them in this moment, I think the better, because there is a lot of confusing information out there. But if you go to the CDC, if you go to our local health department, you're going to find information that you can count on and rely on.
This is really important, and really glad we have a slide specific to this, because if we could spread this among our 500 employees, imagine how many families that impacts in our community. This is so important, and I Maybe you've had this problem too. I have had many tough conversations in my household and with my family about how to manage this because it's really hard not to get together with relatives. We all think it can be done safely. I also want to point out like that from the health department's perspective, right? They put out an advisory. They put out a stay-at-home advisory. And I'm hearing people say, well, it's just an advisory. I don't have to do it, right? The health department, when they talked to us, said the only reason it's an advisory, the only reason it's not an order, forcing everyone to stay home, is because they're not allowed to do that. So that's how serious it is. It's not that they put out an advisory because it's not a big deal. They put out an advisory because that's literally the only thing they can do. That's the most power they have within a county government. So we need to all take that very seriously. Spread is massive right now. Our hospitals are filling up. There was one call we were on where someone's and this just, the hospitals are filling up, and someone said, "Well, it's not a big deal because they're just going to convert the IX center into a hospital." Which, okay, great, but you know what? If I get COVID, I don't want to be treated in the IX center. So let's try to not have to use the IX center as like the backup plan here. So I can't reinforce the importance of this enough. We cannot enforce this as an employer. If someone does this, they're not going to be in trouble with us. But as much as possible, we hope that people will really listen and follow this advice.
So, you know, if anybody's struggling on how to communicate this with your staff, you know, reach out. Happy to role play or to just, you know, talk through some different ways that you might practice saying this to your teams. As Eric said, it's absolutely critical. If we can't get this right, then the impact that this has to our community, not just to the people we serve, but to our neighbors and our friends, it's devastating.
If you haven't heard, the current surge is tied back to Halloween. Halloween parties, most of which were outdoors. Halloween parties are causing this current surge. Could you imagine what Thanksgiving is going to do if we don't change what we do?
So keep in mind that a negative COVID test is not a reliable source of whether or not it's safe for you to be around other people. That test reflects the point in time at which you received that test and absolutely nothing else. You can receive a negative COVID test up to 2 days after you have been in contact with someone who was positive, and in the next hour or more, you could test positive. You could test negative and come into contact with someone who is positive and pick up COVID and carry that to people you love and put them in danger. So it's really important that you understand that a negative COVID test is not a pass this holiday season. And again, there's more information about that, and you're going to get these slides. So if you want to click that article at cleveland.com, you can learn more about that. We've had some questions this week about the staff exposure process, and we've tightened up some of our protocols here. So it's really important that we go through them and that you understand what they are. We've also changed things up just a little bit because of the surge in our own internal exposure and positive tests. Rather than just me and Grace and Marcia trying to handle the volume of calls, it's now the entire HR team minus Maria. So if you have a staff member who believes they've been exposed, it's really important that you or that staff member reach out to us immediately. Be real clear with your staff member. Are you reaching out? Am I reaching out? It's always actually better if the staff member reaches out to us because we have questions. We actually have a lot of questions that we need to ask so that we can make sure that we're giving them the right information and that we're taking the appropriate steps to keep our workplace safe. We've changed the process for staff getting tests at our own testing sites. Of course, we're pretty clear with staff. If you have been exposed and you want to get tested, great. If you've been exposed and you just want to quarantine and not be tested, that's okay too. You just have to make sure that you're fulfilling that quarantine based on that exposure that you've had. But for peace of mind, oftentimes people do want to be tested. So because of our increased volume, we've changed our process up a little bit in an important way to help us prioritize. So HR now has a link to an online registration process, which we will give to any staff member who's had that exposure or is experiencing symptoms. This allows us to get that staff member in a little bit more quickly and help prioritize them. If you just wish to have a test, you weren't exposed, you're not symptomatic, you just wish to know, we're asking that you please call the 325-WELL number and schedule your testing appointment through that system. If you have, if you or a staff member has been exposed, it's important that we're following these guidelines about returning to work after an exposure. There are a number of factors here, and they're different for early learning than they are for healthcare, for example. So rather than try to explain what all of those are in this call, again, it's just really important that HR is contacted so we can help people navigate through what that is, and we can make sure that we're maintaining a safe workplace. One of the things that's changed this week after consultation and guidance from the county health department is that we are no longer permitting an early learning staff member to return to work on site based on a negative test. That's any kind of negative test. This will help to make sure, as we talked about in that earlier slide, that negative test is just that point in time. So this helps us make sure that we're not exposing anyone in those classrooms any more than we should.
Carrie, there's a question I just want to raise that was sent privately. Can you just clarify reporting exposure to HR? This is all exposure, even if you are working at home and you are exposed in the community versus being exposed at work.
Yeah, so we do want to know about that. And the reason we want to know it is because this is all brand new to us, right? This is the first time we've ever lived through a pandemic. And, you know, we think it might be helpful for us to understand what's coming. And exposures can help us understand what's coming. So as Eric was talking about before, as it relates to our ability to continue to serve our clients and that business continuity, if we start to see that a certain department has a number of people who are exposed, that may be some insight into some potential for people to be getting sick in that department. And what does that mean in terms of how we plan and how we respond? Okay. If you are ill and you're experiencing COVID symptoms, notice I'm not saying if you're positive. So this is if you're ill and you're experiencing COVID symptoms. Our protocol is that you are, now this does not apply entirely to healthcare. Like I was saying before, there are some slightly different rules for healthcare. But generally speaking, if you are experiencing these COVID symptoms, we're telling you and your staff that you cannot return to work until 10 days have passed since the onset of those symptoms. Or, and this is not true for early learning, right? So again, these are all these nuances that we have now. Or your doctor has provided a note to say this is not a COVID-related illness, or you've received a PCR test with a negative result for COVID. Now, again, this is for early learning, there's some nuance here. If your doctor says, well, this isn't COVID related, we know exactly what this is, a person can return to the work site.
at 1:45 again.
If, if someone's experiencing several symptoms, we may take a closer look at this and advise whether or not a person should be returning to the work site. We may get our own healthcare professionals involved in that kind of a decision. And that's why it's so important just to let us know so we can help work through it. I do want to talk quickly because we've had some questions around this. We are not accepting rapid COVID tests for return to work because there is a high false negative result associated with those COVID tests. If I'm not mistaken, I think it's, they're only correct something like 85% of the time, which that's not helpful. Again, we risk exposing other people in the workplace in the event that we do have a false negative. And then finally, a person needs to be fever-free without the aid of fever-reducing medications. For 24 hours, generally 72 hours in early learning, and the symptoms need to have improved in order for someone to come back to work after they've been ill. And this again is assuming this is not a positive COVID test. That situation is different. A positive COVID test is the 10 days have passed and you're fever-free. We skip that or in between.
Carrie, we have another question in the chat.
Yeah.
Can you talk a little bit about how this may affect employees who do not have sick time, if they do have to stay home, and if they don't have a sick time left, what should they do?
Yeah. So the sick pool leave that we implemented back in the early summer is still available. We still have hours left in that pool, plenty of hours at the moment. So if someone is out sick and it's COVID related or COVID suspected, they can take advantage of that sick leave pool. They just need to reach out to HR. They can send an email, or you could send an email to HR team at the centersohio.org, and we will work through making sure that that person gets that sick time available so they don't lose pay.
Just another follow-up question to that came through. How long will that pool be available, and what happens after that pool is depleted?
Well, earlier in the summer, we said that if the pool got to a point where we felt that it needed to be replenished, we would send out an email letting folks know that we could use some more donations to the pool. That hasn't happened yet, but we would certainly send out an email letting people know about that. At this point, our plan is just to continue that through the pandemic. Okay, this is a chart that everyone's probably pretty familiar with. We have made some updates to it in the last week, again, just to make sure that we're real clear on what the process is. And it's a helpful reminder when you're in the midst of a staff member, letting you know that they've experienced some COVID symptoms or that they've had a potential exposure. Something for everyone to keep in mind is that 15 minutes of exposure is really a cumulative 15 minutes over the course of a day. So, we ask not just who did you spend time with, but like how much and, how many times. And again, I mean, the important point here really is they all end with please call HR. So please call HR. Please remember to fill out the call off form as well. Go ahead. So, I think we're all aware of how difficult this time has been, and it continues to be difficult, I think, especially as we just become more and more fatigued with the situation that we're in. It's especially difficult too, I think, for our staff members who live on their own, right? For many of our staff members who live on their own, work creates an important community for them. And for us to have spent so many months now, for those of us working at home, without that community that we're able to achieve when we're at work, I know it's difficult. I know it's difficult for our working parents who are trying to juggle the school, whether it's open, whether it's closed, whether it's virtual. You know, I think we're all just trying to get through this as best we can to make sure that we're serving our clients as best we can and working together as a team as best we can. And that's certainly our top priority, right, is to make sure that we're caring for our clients and caring for our staff. We are going to be doing a wellness check-in in the next couple weeks. And I'm going to be sending out some information to help you, as you're having your one-on-ones with your staff, support the efforts that we're and the answers that we're looking to get through the wellness survey, but also support the conversations that I know you must be having during your one-on-one discussions with your team members right now. I want you all to remember that we've got our EAP, Ease at Work is out there, ready to help in any way that they can. And Grace is working with them right now to do a couple sessions in December around our own wellness and well-being, and also around, you know, just navigating through the holidays this year. And some of the, you know, the holidays are a stressful time anyway, and now we've got this new stress with COVID and the pandemic as well. So watch for those. As Eric said in the beginning, it's often important for us to tell people about things in lots of different ways through lots of different channels. So when you see that come through, if you could take a moment to talk about that at any team meetings you're having, if you can take a moment to stress that during any one-on-ones that you're having with your staff, so that they hear it a couple times in a couple different ways, and hopefully it connects and they're able to get that information, take advantage of those services in a way that's helpful and supportive for them. And then last but not least, any other questions that you have for us today? And there's plenty of folks on the line, so I think even if it's not a question for me or a question for Eric, I think there's others who can answer questions as well.
While you guys are thinking about that, I just want to recognize, kind of honor and recognize our staff who can't necessarily stay home all the time, who are, you know, really the heroes who are coming into work to make sure the organization continues to move forward and that our clients continue to be served. So this includes everyone from our facility staff who make sure our facilities are running, our finance team who has to come in on a pretty regular basis because it's just stuff they can't do over the computer. Our IT staff are coming in to make sure that our IT systems continue to work. Our CSR and screening staff at our health centers. Our healthcare providers, the nurses, the doctors, the MAs, the pharmacy, our syringe exchange program, outreach workers, our dental staff, our early learning teachers, and last but not least, those staff who are our COVID testers who are outside, not only being exposed to the weather, but having to work with possibly people who are positive with COVID. So I just want to really thank all of you. It is, it's not lost on me what that means. The Basic Needs Resource Center and the kitchen team as well. Thank you, Carol, for reminding me. And if I left anyone out, it wasn't intentional. So please, any questions? You know, I think some of the feedback I think our executive team gets frequently is that sometimes communication isn't as good as it could be. And so, you know, we're all trying to make a really concerted effort to improve that. A big part of that, though, is making sure that we have this two-way communication so that if something we say isn't clear or we missed something, which we certainly could, that we can hear from you about those things. So please don't be shy about asking questions or making comments.
we do have a question in the chat. Hold on, I'm just reading it real quick to kind of frame it here. So if a staff is, let me just read this question. We may need some clarification. Have we thought about eliminating a negative test to return to work, even if staff don't feel that they have been exposed, especially at this time, because we can be exposed and not know?
You know, I don't think we're closed to that idea, but we do know that we have some staff who have some either chronic or just well-established conditions that may, at the very surface, look as if they're like a COVID symptom, but the staff member and their provider know that it's something else, and we wouldn't want to always have to exclude them from work just because it, you know, it is a COVID symptom, because it doesn't necessarily mean it is COVID. But that's certainly subject to change as things progress.
Just another question. Thanks, Carrie. Another question that came through. Just to be clear, all counselors should work from home. Should supervisors and program managers come into the office as well still?
Yeah, so that's really a question for Martin about what are the essential workers and what do we need to do in terms of keeping facilities open and make sure clients get what they need. So Martin, do you want to answer that now, or do you want to follow up with your team?
Sure, I can answer it now. We're at this point, we're going to continue to work as we are. We still want staff to be able to still come into the office. I know majority of our work is telehealth. We want to continue to do that. And if people are coming in, we want to make sure we're keeping our 6 feet distance away from people and working with clients in spaces that allow for that. So we're not changing the way that we are providing services at this time. However, if we go to a purple or a level 4, then we will reevaluate where we are and make changes then.
All right, anything else? Going once, going twice. All right, sold. Thank you everyone so much for gathering together on this pretty short notice for this half hour today. I hope you all have a wonderful and safe weekend. Take care of yourselves. I say this to myself: walk more and drink less in terms of dealing with the stress. You know, we have to take care of our own mental health as well, and so please do that and take care of your families.
Thank you.
Thanks everyone.
Take care, everyone.
Thank you.
Thanks. Have a good one.
Thank you.
Alexa won't let me leave.
I'll boot you out here,
There
Carrie.
we go.